Here with Dr. Vidal at Pure Plastic Surgery. This is our weekly check-in to discuss different topics in plastic surgery and answer your questions. We try to meet every Tuesday, but most Tuesdays we are here around 3 to 4 o'clock. And today we're going to be talking about tummy tucks. Tummy tucks in general, all the different types, what are the difference between the different types, what you need to know about tummy tucks, and then we'll jump into some questions related to tummy tucks and related to anything that you want to ask me related to plastic surgery. Okay, so tummy tucks. What is the things that target an abdominoplasty, which is the medical term for a tummy tuck? It targets three things. Okay, the tummy tuck surgery will take care of excess skin, will take care of muscle separation, and will take care of excess fat. But excess fat in a specific compartment, and I'll talk a little bit about that. Let's talk first about the muscle separation, okay? Diastasis recti is a medical term for muscle separation, which is very commonly seen after pregnancies and after weight loss surgery, okay? Anything that increases the intra-abdominal contents, or it distends your abdomen, separates the muscles in your abdominal wall. So this is the normal anatomy for the abdominal wall. We have the two rectus abdominis muscles in the middle, which are the six-pack muscles. They should be close together, and this white line in the middle, it's called the linea alba. Usually this line is thin and the two muscles are close together. This helps the abdominal wall have muscle tone, and when you work out, the muscles contract and you get a flat tummy. This anatomy is important for that. Whenever we have increased the space in the intra-abdominal compartment, either because of a pregnancy or because of weight gain, it distends the muscles. These muscles tend to separate in the middle like this. So the two muscles, rather than being close together, separate to allow the abdominal wall to distend and create a beautiful baby or have fat inside. So when the two muscles, when you either lose the weight or deliver the baby, sometimes these muscles don't go back to the middle like they were before. And they end up with a diastasis, which is this separation. The linea alba gets wider, okay? And this problem causes, because this tone is lost, so when you look yourself on the lateral view, you can still have a bulgy belly or an appearance of still being pregnant. That muscle doesn't contract, so it's like this, and this doesn't have any tone, so it causes that bulging, okay? This is not going to get fixed by working out, unfortunately, because this separation, when you work out, these muscles can contract, but it's not going to bring it back to the middle. The only way of bringing it back to the middle is surgically stitching this back to the middle and bringing this linea alba thinner how it was. And this is one of the things and one of the most important aspects of a tummy tuck. And how does the tummy tuck reshape your torso? A lot of people say after a tummy tuck that they feel that they have more control of their torso or more tone. And it's because of this, because the muscles are reestablished in the middle and you can have more tone in your torso, in your abdomen, okay? So this is one of the most important parts of a tummy tuck, okay? The muscle separation, and that is gonna flatten your belly, okay? But when explaining this is very important, and why with a lower BMI you're gonna have better results with a tummy tuck, and it has to do with the excess fat and where is the excess fat. So there are two areas where the fat in the abdominal area accumulates. One is in the visceral compartment and the other one is in the subcutaneous compartment. And I'll show you a picture so you can see what I'm talking about. So this here is a diagram of a person standing on their side, right? This is the belly, this is the buttock, these are the breasts, okay? So it's like you're seeing the person on a side view, okay? And here you can see the different layers in the abdomen, okay? So we have the skin, which is pictured here with this light pink line, okay? This yellow area here, it's a subcutaneous fat. So it's the fat that is between the skin and the muscle, okay? This fat here is the one that we can liposuction. This fat here is the one that you can pinch. So when you're pinching yourself, that thickness is the one that you can pinch, and that's the subcutaneous fat, okay? Then you have the muscle, which we saw in the previous picture, that it can separate and back. But deep to our muscle, inside of our belly, we have all our organs, you know, the stomach, the liver, the bowel, and around the organs is visceral fat. So there's fat inside of our abdomen too. Unfortunately, this fat cannot be reached with liposuction. The only way of losing this fat, because it's around our organs, the only way of losing that fat is with diet and exercise. And that is why it's so important to have a good BMI to optimize your results, okay? Because if you have a lot of visceral fat, right, the amount of tightening I can do with your muscle is limited, because this is gonna be filled with fat. If you lose the weight before, the amount of visceral fat is gonna be less. Therefore, I can tighten that muscle better and give you a flatter tummy, okay? So that result is gonna look a lot better, okay? So this difference is very important, and it's very important to understand, because this difference is also the difference mainly between liposuction and a tummy tuck. Liposuction only is gonna remove this fat. A tummy tuck is gonna work with the muscle, with this, and the excess skin. So 3 things, not only one like liposuction, okay? So excess skin, I'll talk a little bit about describing the different types of tummy tucks, because the majority of the difference between the different type of tummy tuck is really the amount of excess skin that you have, okay? We talked about muscle separation and the excess fat. I do liposuction with all my tummy tucks. I think it accentuates the results, but it is important to understand where I do the liposuction, okay? There are 2 main reasons why I don't do lipo 360 or the entire torso when I'm doing a tummy tuck. The first reason is safety, okay? When you're doing a tummy tuck, and I'll show you a picture here of what is the procedure itself. It involves removal of the excess skin in the lower abdomen. So you see this excess skin down here that is kind of flipped up, okay? It involves repair of the muscle, and it involves bringing that skin down and tightening everything and closing it up. When I lift all that skin up like this to do the muscle repair, this skin, now that it's been elevated and brought down, it's been cut from its blood supply. So the skin blood supply comes from the muscle. But in order to repair the muscle, I have to elevate like an apron and then put the skin back up, okay? If I go and do liposuction on top of bringing it up and down and thin that down, the blood supply is going to be more compromised, which puts you at a very high risk of skin necrosis, infection, and wound healing problems. Okay, so that is the main reason why I don't do liposuction in the center here, okay, and or a 360 when combining with a tummy tuck. The other reason is because of limitations or guidelines from the Florida Department of Health, because I'm doing a surgery in an office-based facility, okay? And that goes back to safety too, okay? The reason why there are limits when I'm combining with an open procedure is because you're going home, you're not staying in a hospital, you're not being monitored for 23, 24 hours after the surgery. You are going home with a family member. So we have to have some limitations because there is some recovery and there are some risks when we are doing an extensive surgery such as a tummy tuck and a lipo 360. So the limit on a Florida Department of Health when I'm doing a tummy tuck is to remove 1 liter of fat max, okay? And that 1 liter of fat max, usually reach it with the liposuction of the flanks, okay? So when I'm doing a tummy tuck, I do liposuction, but I only do liposuction to the flanks, which is the sides here, okay? To avoid liposuction in the center, risk of skin necrosis, wound healing problems, and I max it out as 1 liter, and then you can go safely home without the risks of dehydration, blood loss, and not being monitored adequately, okay? So that is the 3 things that compose a tummy tuck. So let's talk a little bit about the difference between the different type of tummy tucks. I think this is getting more and more popular, and I'm getting more and more questions regarding the different types of tummy tucks. Because in social media, we're hearing more and more about the different types of tummy tucks. And whenever we put the word mini in front of any procedure, we want that, right? It's like, it's mini, I want that. Well, the reality is that not everybody's a candidate for a mini tummy tuck, okay? So let's talk about the regular or traditional tummy tuck. What does it involve? It involves the 3 components, okay? It involves removal of excess skin in the lower abdomen, muscle separation repair or muscle repair, diastasis repair, and removal of excess fat from the flanks. The incision is from hip bone to hip bone, okay? And around the belly button, because as I showed you in the previous diagram, I pull the skin down, I leave the belly button attached to the abdominal wall, pull the skin over, and then make a new hole to bring it out. So at the end, you're gonna have the scar around the belly button and the scar low in the front from hip bone to hip bone, okay? So what involves skin, muscle repair, and lipo. That's the traditional tummy tuck, okay? A mini tummy tuck, it's a shorter incision. Why is not everyone a candidate for this? Has to do with the excess skin that you have, okay? So if you pull your skin, and when you pull it, you can see a fold of skin that reaches from hip bone to hip bone, then that's the excess skin that you have. So if I remove just a tiny piece of skin from the mid, like a C-section length of scar, then you'll still have excess scar on the sides, and it's not going to give you a good contour, okay? So that is the main reason why not everybody's a candidate. It depends on the amount of excess skin that you have. The other difference between a mini tummy tuck and a traditional or a regular tummy tuck is the mini tummy tuck does not include muscle repair, okay? It's for someone that has very little. Usually I see it with people that has had C-sections before and have just a little bit of skin down where the C-section scar is, but there is flattening of the abdomen. So if you see them on the side view, the belly is flat, so you don't have the muscle separation, and there is no excess skin around the belly button, okay? So there's something called umbilical hooding, or the skin where instead of being a circle, the belly button, it's more like this because the skin over it kind of hangs over like an apron like this. So if you have that, that means there's excess skin that reaches up to the belly button. And by just removing just a little bit of skin in the lower abdomen, it's not going to change the shape of the belly button, and it's not going to take care of the excess skin that reaches the belly button area, okay? So mini tummy tuck, although it's great, and I wish everybody was a candidate to do small scars and hide them very well, the unfortunate part is not it's very few people are candidates for this procedure. Very specific on the candidate that it's going to benefit from a mini tummy tuck. Reverse tummy tucks are getting more and more popular in social media. The reality of the reverse tummy tuck is similar to the mini tummy tuck. It is for people with very specific excess skin. Why? Because instead of pulling it down like a regular tummy tuck, the reverse tummy tuck pulls the skin up, okay? But it does not include muscle repair, okay? So it's skin only like the mini tummy tuck, skin only, and pulls the skin up and hides it below the breast, okay? Like the Weiss pattern or the anchor type of breast lift, okay? So it's removal of a pattern more or less like this of skin, pulling it up and closing it under the breast. So it takes care of excess skin around the belly button. If you have a little bit of hooding over your belly button, but no excess skin down here, and the belly is flat on a side view and it's just a little bit of skin, then you might be a candidate for a reverse tummy tuck. It's just pulling the skin up to get rid of that putting up skin without muscle repair, just pulling it up, okay? So very few people candidates for a reverse tummy tuck. What I've seen is people that has had liposuction before and have just a little bit of a skin excess above the belly button are good candidates for a reverse tummy tuck. But again, no muscle repair, so the belly should, it's for people that have a flat belly or the muscle in the position that it should be, okay? What is a paniculectomy? Paniculectomy is, so it comes from the word panis. Panis means apron of skin, so it just takes care of skin. And this procedure, it's more a reconstructive procedure for people that has had massive weight loss and have a lot of excess skin, an apron of skin hanging. And a paniculectomy, it just excises that apron of skin and closes it. It's not gonna do muscle repair. It's not gonna reposition your belly button. So it doesn't bring the waist in. It doesn't flatten your belly a lot. It's more a reconstructive surgery for people that actually have limitations in their daily living because the skin fold, it's impending in their clothing, in their exercise routine, and you just do it temporarily most of the time so they can continue their weight loss journey and get to the traditional tummy tuck when they finish their weight loss. So paniculectomy, more of a reconstructive procedure, only skin, but the extent of it is more, it's not just like the mini tummy tuck that is less, it's more from the sides to the sides, so the extent of it, okay? And the circumferential, usually seen also for tummy tuck, for weight loss patients, that when the extent of skin continues to the back and you have excess skin, it goes, like if you're laying yourself flat on the bed, the skin goes past that towards your back. And that's a circumferential tummy tuck. It can be done with the muscle repair and liposuction. I usually don't combine it, same, because I'm in an office-based procedure, surgery center, and you're going home afterwards. Circumferential tummy tucks are usually for patients that stay overnight. So whenever I'm doing, or whenever I have a weight loss patient that it's a candidate, I usually stage it and do the front first. It's very common for my weight loss patients to come in and have their breast procedures made plus or minus arm lift with the tummy tuck. We take care of that, and then they can come back on a second surgery and we do the back part, either the lower back lift or the upper back lift, depending on where the skin excess is more, okay? Another procedure that's very common for massive weight loss patients is a Fleur-de-lis abdominoplasty. What is a Fleur-de-lis abdominoplasty? It's basically when you have excess skin in the upper abdomen. So in this area, you have folds of skin too, not only down here. So this folds of skin you bring to the center and excise the skin in this manner. So this is the pattern that you excise. The belly button stays there, and at the end, the incision looks like this, with the belly button in the center, and that takes care of excess skin in the upper abdomen, which is sometimes common in massive weight loss patients, okay? So I'll take some questions now. Hope this helped out explain some of the differences in between the tummy tucks.
This is another question, but can you talk a little bit about the recovery?
Yes, of course. The recovery with a tummy tuck tends to be harder in the first 1 to 2 days, mainly because of tightening, okay? It's not a very painful procedure, but more the uncomfortable, because I put everything is tight, right? The muscle repair and the skin. So there is an option to add a medication called Exparel. Exparel is a medication that it's a local anesthetic that lasts for 72 hours. So I inject it in the muscle and I inject it in the skin, and it helps to numb those two areas, which are usually the most painful areas after a tummy tuck for the first 3 days, okay? So it is an option. If you are scheduled for a tummy tuck, you can ask your coordinator. It's an added price or an added cost, but you can ask your coordinator to add it, and I think it helps a lot with the post-operative pain. So you're gonna have 2 drains. I put 2 drains in the tummy tucks. Those come out in the corners of the incision, okay? And usually stay between 2 to 3 weeks, depending on how much the drainage is. For compression, at first you're gonna be using a binder, okay? That I provide to you. You're gonna wake up with the binder on. And that binder you're gonna use for the first 2 to 3 weeks while the drains are in. Okay, once the drains are removed, then you transition to a faja or a compression garment, and that you're going to use until you're 6 weeks out at all times. Okay, the 2 most important things about the recovery of a tummy tuck is 1, avoiding blood clots. Okay, so tummy tuck surgery is a procedure in plastic surgery that it's mostly associated with blood clots. The reason for that is because of all the tightening. Okay, I tighten your muscle and your skin so there is more resistance from the blood in your legs to circulate back to your heart, okay? So there are a couple of things that we do to try to minimize the risk of blood clots after a tummy tuck. 1, and the most important one, is walking. So you should be walking the day of surgery. After you wake up from the anesthesia and you have the effective anesthesia kind of wean off, you should start walking every hour for 10 minutes. And the other thing that I'm gonna give you, it's compression socks and a device called a sequential compression device that you put in your calves. It's like a wraparound with a Velcro that inflates and deflates and massages your calves to improve circulation, okay? So all of my tummy tuck patients will go home with a sequential compression device that you're going to be wearing for the first 2 weeks at night and when you're resting.
Can you please talk about the dog ears and how to fix it?
Yes, dog ears is a possibility after a tummy tuck, and the reason for that is the excess skin part, okay? There are 2 main reasons why you may end up with dog ears. 1 is because you have excess skin extending past where the bed allows me to operate, okay? So remember, you're gonna be laying in your back for the surgery, and to keep the area sterile, I can't go near where the bed is. There's a limit, and there are some drapes and towels that I put sterilely to mark the area that it's clean and that I'm operating at. So if you have excess skin that extends past that, sometimes you end up with a little bit of a dog ear, which a dog ear is basically excess skin in that corner, that edge of the scar. And the good part is that it can be taken care of with a small minor procedure in the office with local anesthesia and excising that excess skin. The other reason that I've seen that increases the risk of having dog ears later on is because I'm combining this with liposuction. I do liposuction on the flanks, and if you are a person with a lot of fat, especially in the lower flank area where your hip bones are, and I empty that, there is some inflammation at the time of the liposuction that impedes me, or it doesn't allow me to tighten that very well. And with time, when the swelling comes down, you may see a little bit of excess skin there. Again, if you have it, it's a minor procedure that I do in the office, excise it under local anesthesia, and take care of it.
Okay, let's see. My surgery with you is March 9th. How
Awesome.
long after first faja do you move on to the second faja?
Okay, so for a tummy tuck, you are gonna have the binder at first, and once the drains are out, that's when you switch to the faja, usually 2 to 3 weeks. If you're having liposuction, then you're gonna wake up with a stage 1 faja, okay? A stage 1 faja just means low compression, and a stage 2 is a high compression. Usually you're gonna wear the stage 1 for 7 to 10 days. After I see you on the follow-up, if the skin looks good, I'll let you know when to switch to stage 2.
Well, this is like a advice, I guess. Can you do an informative video like you did last week with lipo, but on the BBL procedure?
Yes, of course, we can do that next week. I'll talk about BBLs and what it involves and how to prepare and everything.
Okay, this is a good one because I heard you don't do patients over 50. I'm in good health. I'm 51 and I want a BBL.
Okay, so the reason why I don't do liposuction on patients over 50, it has to do with two things. The skin quality is not the same, even though if you're not overweight or anything, the skin doesn't retract well, and the results of liposuction are not that great because liposuction, like I explained, it relies on the skin retracting, and when the skin doesn't retract very well, it creates irregularities and the appearance of your abdomen may look worse after liposuction. And the other reason is because liposuction and fat transfer is a surgery that, even though it does not involve large incisions like a tummy tuck or a breast surgery, it actually has a bigger toll on your cardiovascular system, okay? Because the removal of 4 liters of fat and transferring the fat puts your body in a metabolic state that it's very, very demanding, okay? And unfortunately for older patients older than 50, this may be dangerous for your heart, for your blood pressure. It's not the same running a marathon when you're 20 or running a marathon when you're 50. So the metabolic demand takes a toll in your body that even though you're healthy, the response is not the same.
Okay. Hoy es el viernes. No sé si lo pudiera explicar un poquito en español, el cuidado del tummy tuck.
Seguro que sí. Qué bueno, que ya mismo te veo y te voy a explicar todo esto otra vez, pero lo decimos en español, que prefieren y se sienten más cómodos en español. Básicamente, para luego de la abdominoplastia vas a tener 2 drenajes. Esos drenajes van a estar saliendo por las esquinitas de la herida y se quedan más o menos 2 a 3 semanas dependiendo del drenaje. Vas a estar utilizando un binder, que es un método de compresión que es como elástico y con velcro que se pone en el torso, y eso lo vas a estar utilizando por las primeras semanas mientras los drenajes estén puestos. Una vez los drenajes se remuevan a las 2 a 3 semanas, entonces vas a cambiar a una faja y vas a utilizar la faja hasta que estés 6 semanas postoperatoria todo el tiempo, ¿ok? Los masajes son sumamente importantes, los vas a comenzar al otro día. Los masajes van a estar enfocados en las áreas de liposucción primero, por las primeras 2 semanas, y luego es que puedes empezar a dar masaje en el centro, en el área de las incisiones. Y lo más importante luego de la cirugía de la abdominoplastia es, número 1, evitar coágulos, ¿ok? So, te quiero caminando el mismo día de la cirugía, manteniéndote hidratada, vas a tener unas medias de compresión y unas medias que te van a dar masaje en el área del calf, de las batatas, para promover circulación. Y lo otro es proteger las incisiones, que vas a estar caminando dobladita y tienes que dormir un poquito semi-sentada para proteger esas incisiones.
How long do I wait to get a tummy tuck revision? I got an extended tummy tuck by another surgeon and I still have loose skin.
Okay, so a revision, I always recommend waiting at least 3 months. There's a lot that changes with the skin tightening, the scar, inflammation. So it depends. At least a minimum of 3 months. The best to do a revision that it's going to give you the best results is to wait a year after your prior surgery.
Okay, and this is the last one for today. How do I request a quote?
That's the simplest thing. Go to our website, pureplasticsurgery.com, and you're going to see a link that says virtual consultation. You're going to click there and it's going to open a questionnaire. Answer those questions and it's going to ask you 3 pictures, 1 front, 1 side, and 1 angled view, okay? And you're going to send those in. I'm going to evaluate all that information and a coordinator will get back to you with my recommendations. Okay, so guys, I hope this helped out. Like I said, the different type of tummy tucks is basically if you're a candidate and what is it that you need. If it's just skin resection, the extent of the skin resection, lipo, muscle repair, or all of the above. I'll get back with some advices regarding BBL next week, so tune in next Tuesday for talking about BBL, the recovery, and all of that. And I'll see you next week. Okay, you guys. Bye bye.